Off a brand new week, we welcome Dr. John Witcher. He is a candidate for governor running as a Republican. Good morning, Dr. Witcher. Thanks for coming in.
Yes, sir. Good morning, Gerard. Appreciate it.
Yes, sir. So tell us about your history with political office. Have you ever run before?
I have never run before. I am a medical doctor, been a medical doctor here in Mississippi for 25 years. I'm born and raised in Mississippi. I was born in Meridian, raised on the Mississippi Gulf Coast in Ocean Springs. My father's from Tupelo, my mother from Yazoo City, so I've spent a lot of time in those areas growing up. But I'm a Mississippian, and I love Mississippi. I love the people. I've been all over Mississippi working in these little towns. I started a company early on in my medical career as a young doctor, Mississippi Physician Services, where we staffed these little hospital emergency rooms primarily and some urgent care clinics, that sort of thing. So I've been in probably 12 or 15 different hospitals, either personally working or contracting with these hospitals. So know a lot of people throughout the state and just know the healthcare situation. When COVID hit, I was the medical director of a little hospital in Yazoo City, and that's what really got me into politics. I didn't, politics came to healthcare. I didn't necessarily go to it, but that's how I got into politics.
Okay, gotcha. So that you felt like the pandemic itself, COVID, et cetera, that kind of upended the whole country, whole world, honestly. That you feel like is the motivation for you to enter the race here?
Yeah, that's my main motivation. Tate Reeves, he was my neighbor. He helped him campaign, voted for him. But, when COVID hit, I don't think anybody knew what was going on. But by the time Biden got in there, these lockdowns, mask mandates, school closures, business closures, church closures, the whole works. People out there, we know the masks don't work. There's no scientific evidence that shows that. But yet our public health department officials, adamantly said these masks work, period, and that's just not the case.
Gotcha.
Yeah.
So just looking through some of your campaign materials, Dr. Witcher, one of the things that you highlight is that you're pro-business. And you say, and I'm just reading your card here, he will make a smooth path for new development, cutting regulations and reducing tax burdens. Can you elaborate on that?
Well, I grew up with Ronald Reagan. 40 years ago, I was 17. And, I think the American dream back then was alive and well. I felt like, I believe anybody, you can come from any walk of life. And through hard work, integrity, a commitment to excellence, I think anybody should be able to be successful in America. Today, I don't believe that's the case. I think, we have to, this is a big thing. Our economy is failing. Just look over the last 3+ years since Tate Reeves has been governor. Our interest rates have doubled. Our gas prices have doubled. 401ks are not doing as well. So just 4 years ago when Donald J. Trump was there, everything was going well. And, the grassroots people in Mississippi, the conservatives, Republicans out there, they understand what's going on. Our politicians, our career politicians, whether it be Tate Reeves or the others, they're going out and what they're campaigning on is that Mississippi's never been in better financial shape than it is today. And that may be the government end of things, but the people are suffering, and they know that. They want to see the economy coming back. They want to see closed borders. They feel like this whole thing where they don't know what's coming through the border, whether it be drugs, criminals, terrorists. Sex trafficking is a big problem. I guess recently watched Sound of Freedom. People are concerned about those things, but the people want protection. They want their money to be protected, their property, and so as a business person, I believe our government must balance their budget. We must get rid of corruption. We must have a smaller government, not a bigger government, and so that's.
So from the state of Mississippi's perspective, I appreciate that. Most of that seems to be more federal related. But from the state of Mississippi perspective, do you support elimination of the state income tax?
I do support that, but it has to be done in a correct way. We have, $8 billion that comes in through our taxes. And, we have to find a way to generate that income. First of all, we need to cut government waste. We need to bring down our budget. But, we can't. We want to be more like Tennessee. Texas, Tennessee, Florida, they don't have state income tax, but Tennessee, their land taxes, property taxes are not high. So in Mississippi, we want to be careful about that. We don't want our property taxes to go sky high if we eliminate the income tax. But yeah, I mean, we should have ways to help people on the local level, whether it be income tax elimination, and so we can compete better with our neighboring states, but also taxes on groceries. I mean, baby items, for example. We want good people to come to Mississippi, and there's other states. Florida, for example, they've eliminated taxes on baby items to encourage good working young families to come to Florida, and that's what we can do here.
Would you support restoration of the ballot measure process, the citizen-initiated ballot measure process?
I would.
Okay.
I think that's fair, and the ballot initiative. I think that's the conservative way. I think the people should have the vote, and there should be a way to reinstitute that.
What about school choice? Where do you stand on that?
I believe in school choice. I believe that I know we have charter schools here in Mississippi, but that our state government helps run. But that if you look into it, which I've been looking into, so it's not doing well. Okay,
yeah.
We need to find a way. I don't believe your zip code should determine what kind of education you get. I'm for school choice. I'm for parents being involved, but I'm also, we need to look at the Mississippi Department of Education and see where the wasteful spending is. It's very top heavy. Okay, this money needs to get down to the teachers, the students, and the parents really need to get
term
involved.
limits. Do you have a position on that?
I do have a position on term limits. I would prefer that politicians would term limit themselves and move on. But yeah, I think we have we need to have term limits. We need to have right now. The people are crying out. Our elected politicians, our Republicans, many of them are out of touch with the people. And so I think we see in this election period, you're going to have there's a lot of different folks running, and I'm hopeful that we're going to get some new folks in there because that's what the people want.
Medicaid expansion.
Well, if Medicaid expansion would solve the problems, I'd be for it. But I've been a doctor throughout Mississippi in some of the poorest areas of Mississippi, and so I understand there are problems out there, but just creating increasing Medicaid and creating a bigger top-heavy situation, we need to find ways to get the money to the people. And, we can assign things like these patients need a primary care provider, whether it be a doctor or nurse practitioner, and work one-on-one with that patient from their lifestyle to the way they're treated, and quit using, the hospital, for example. The emergency rooms, most visits in the emergency rooms are not emergent. They need to go to their primary care. But so there's many ways to do that. I don't, the certificate of need needs to be opened up to more private enterprise so there can be some competition. But there's other ways to do it by just expanding government funding.
Gotcha. What about recreational marijuana? Where do you stand on that?
Well, marijuana is, I understand that's been passed. Medical marijuana is an issue that a lot of people out there believe in. I've talked with lots of folks that feel that's their, it was voted on and it was passed by the people. So
talking about recreational though,
I don't believe in recreational marijuana. I think marijuana can be very much abused, and I think that this is something we need to be very careful about. First of all, smoking anything is a detriment to your health. So I'm not. I think this medical marijuana. I'm not really sure why we would be smoking that. Not only does it hurt that person, but others around them are going to be inhaling marijuana smoke. So I have mixed feelings on that.
Have you taken a look at PERS, the Public Employees Retirement System? It's $19 billion unfunded in the hole.
Yeah, there's a problem. What did it lose? $8 billion last year. Of course, it made $23 billion over the last couple of years. So.
Yeah, it's still the last 10 years has averaged about 7 to 8% return. So yeah. The returns are okay.
But first of all, I guess it's mandatory if you're a state worker to pay into PERS, and it has to be pushed in order to have a payout. But I think the people. It's something we need to watch very closely. I certainly don't believe in ESGs, and I think we need to invest in companies that are profitable and not necessarily that are woke.
Yeah. What about nurse practitioners? You talked about eliminating regulations. We just got about a minute left. Would you support full practice authority for nurse practitioners as a physician?
Well, I think you have to. I've collaborated with nurse practitioners, many of them over the last 25 years. And today what's happening is many of them don't get any clinical training by the time they get out. I think that has to be on a one-on-one basis, but some nurse practitioners can work very independently, others can't. So,
Gotcha.
I mean, yeah.
Gotcha. Dr. Witcher, good luck on the campaign down to about 2 weeks here until the primary day.
Yeah.
Appreciate you coming in.
Thank you.
Yeah. Coming right back in the